So my name is Izuchukwu Ibe. I'm currently a faculty at the University of Mississippi Medical Center in orthopedic surgery. My practice is primarily orthopedic oncology as well as joint arthroplasty. We're supposed to have some guests along with me for this Zoom tonight. The first of which is Dr. Shayna Lipa, who is a spine surgeon currently at Brigham and Women's in Boston. She did her medical school out in UC San Francisco, and then her residency at Harvard as well at the Combined Orthopedic Residency Program. She finished in 2020, and then did her fellowship at NYU Medical Center. And the other guest is Dr. Roland Howard, who's an orthopedic surgery resident at UC San Diego. He did his medical school at Rutgers at the Robert Wood Johnson University. And actually, I'm very surprised. I'm actually not surprised that he hasn't made it onto the Zoom because he's on the West Coast as a resident, and that means it's still a little early. So I'm not sure when he will be.
I'm actually here. I just signed in.
Oh, perfect timing. All right, there you go. All right. Speak of the devil. So it's great to have you. It'll be nice to get a perspective from someone who's a current resident. And then just a little bit of my background. I went to medical school in New York Medical College. I am from New York as well. My residency was at Yale New Haven Hospital, and then my fellowship was at the University of Toronto. So, also, I guess a special guest, we have Dr. Jason Brooks. And Dr. Brooks is very well known to many of you, and he's at Scottish, right? Is that correct, Jason?
Yes, I'm a pediatric orthopedic surgeon at the Scottish Rite Hospital for Children in Dallas, and the med school we're associated with is UT Southwestern. And where before I came here, I was at the hospital where Dr. Ibe is at, and I was associate program director there, and so kind of have some experience working with students and figuring out which students suck or not. And so I think this is a really nice topic so that you can make sure you're not one of those students that suck. That you all can really be your best wherever you're about to go for your sub-Is.
Exactly, and that's the big key is really how can you shine and excel. And I think we'll start out probably by giving some general thoughts about your approach or your thoughts on how to approach rotations, and then we'll go down to different topics. Study tips, etc., how to stay connected, how to get letters of recommendation, how to handle conflicts, and we'll finish with a couple of horror stories. I'm sure everyone has had some of those. Would you like to go first, Dr. Brooks, since you might be leaving us?
I'm sorry, what was your question?
General tips for people rotating.
Yeah, sure. So, and I'm sure Roland will have some more updated stuff. I didn't do my rotations until I was probably when I rotate, sometime in 2010, I guess, because I started residency in 2011. But I think I don't feel like I'm that much older than you all, but I guess I am. I'm 36, but I have noticed even a shift in kind of the overall personalities of the students that I see every year. There is a bit more of the general premise that everyone gets a trophy, everyone is a winner, and everyone gets positive affirmation, and that you get a trophy just for showing up. And I think in medical school also, you are told that you are a vital member of the treatment team. But the truth is, as a medical student, you are very rarely useful, especially in orthopedics where we're used to working without you. And so the problem that you have is how do you show yourself to be useful in a group that normally can run without your help? And what most med students I've seen do is that they go up to Roland or another resident and say, how can I help you? And then when they do all those tasks, then they feel like they've done everything they need to do. And that's actually the wrong thing to do. In my experience, the best sub-interns have been those who sit back and they observe where people need help. And then they see how they can actually be helpful, and they feel the need without ever being told what to do. So that takes perception, that takes a little bit of soft skills, and that really is going that extra step. So, case in point, I did my sub internship at Johns Hopkins, and for the most part, I was on the ped service, and we rounded every morning with the attending. And every morning when we saw a patient who had just had spine surgery, the attending, we would walk into the room, and then immediately the residents would be rummaging through the cabinets in order to find all the different dressings we would need to do our dressing changes. And so what I did is that I along with the other sub-I, we made a dressing bag. And so we were walking around basically with this large, not duffel bag, but tote bag, chock full of 4x4s and tegaderms and Xeriform and scissors and skin tape. And so as soon as the attending put out their hand, we would slap what they needed right in their hand. And again, did that prove that we knew anything about peds? No. Did they pimp us on our overall peds knowledge? Probably a little bit. Did they evaluate us on our surgical skill? Probably a little bit. But you know what? Like, that went further than all those other things. And it was that we saw a need and we filled it. And if you do that, not just on rounds, but in the OR, when your resident is taking call, so that you're already kind of looking through all the patients coming into the ER. And if you see that a patient has an ankle fracture, you've already gone down, you've laid out all the sprint materials that the resident needs. So when they walk into the room, all they got to do is slap the splint on and walk out. That shows that you have already kind of thought about what that resident needs and have filled that need. And I think there's a smaller subset of students who actually can kind of be at that level. But if you are able to be at that level, people will speak volumes of you, and the residents are going to be screaming to get you to come to their program because you've made their life so much easier. And what you want is that when you leave that program, the residents are writing the program director to say, well, you want the residents' life to get worse when you leave, meaning you were feeling such a need and doing so many things for them that when you leave, like, they actually notice that you're gone. If you leave and they didn't notice that you were gone at all, that means you weren't really very helpful. And usually that person that's not very helpful is a person that's always asking, how can I help? What can I do for you? Do you need this? What do you need next? I mean, just the whole process of thinking about how you can help me ends up being more work for me. And so that's kind of my general gist, is having that preemptive nature to figure out where you can fill a need. And of course, you're not going to know everything at the beginning, but so you may have to ask some questions, but you don't want to be asking those questions by your third week either. And so that's kind of my general gist.
Yeah, and Dr. Howard, can you give us some of your thoughts on what Dr. Brooks said, and maybe some general advice for rotators from your own perspective?
Yeah, I think that's tough because I think Dr. Brooks just touched on pretty much everything I would have said. I think for me, the biggest thing going into rotations is just being adaptable. Everyone's going to have, or ideally everyone has their own home institution that you're going to rotate at before you go on a ways. So you'll get into a little bit of a groove in figuring out how things are at your own institution. But you'll soon find out when you go on a ways that places are markedly different in terms of how they approach not only resident, but medical student education, what your role is with the team, what the expectations are for even just how much you're expected to be talking in the room when you're in the OR. So I think if you have one experience and you think that that's how things are supposed to be, it can actually end up hurting you in the long run. So I would say, kind of like Dr. Brooks said, for your first week, you should probably get it quicker than that. But for the first couple of days on your rotation, really just kind of chill, sit back, and watch and observe how things go. Because I think if you do that, it allows you to figure out how you can best be useful. There's always something that you can be doing to help the residents out and to help the team out. So I think obviously the days typically start in the morning. Like Dr. Brooks said, with the dressings, that's something you could do. I know some of our sub-Is who've crushed it in the past. It's very few, but we have a pretty standard routine. For example, on trauma, when we're going to be changing dressings on, say, post-op day 2 for a hip fracture or whatever. So if you know that's the case, and you have several of these patients on your list, and you can get there early, put those dressings that are going to be needed in the room, so that when we get to the room, we don't have to be fumbling to get stuff out of a bag or get stuff out of the dressing cart. things like that go a long way, just to show that you're always prepared and always paying attention. Patient care obviously goes past more than the physical aspect as well. So knowing the patients on your list is a big deal. If you know that you're at your hospital that you're rotating, they typically get labs on their patient. Having a good idea, especially for people that you anticipate to have any lab abnormalities. If somebody has a big surgery, for example, what's their H&H? So just keep that in the back of your head. So if the chief who's running the list says, hey, this patient looks like they're all tacky, whatever, I know we don't normally deal with a lot of medicine, on ortho rounds, but, if something like that comes up and they say, oh, what's this person's labs? You can be the first person and say, hey, I actually checked this and it looks like the hemoglobin is blah, blah, blah. And it just shows that you're always prepared. I think in terms of preparation as well, some residents, like I love teaching, but it kind of stinks a little bit when you do want to get out of the hospital. If you ask a med student at the end of the case, hey, have you practiced tying or do you know how to do this? Which is like everyone should probably know how to tie by the time they get to their sub-I or be able to throw some simple interrupteds. But if you say something like, oh, well, I've tried a couple times and that doesn't really instill a lot of confidence in me. And I want to be able to teach you. But I think if you really want to shine when you're on a rotation, that you want to come in knowing how to do those things. Nobody expects you to be crushing it from the beginning. But the expectation is that you at least practice and have some level of confidence going into rotation. So but again, I think for me, the biggest thing is just being adaptable because places are always different. I rotated at 3 different locations. And I think what allowed me to kind of stand out at each location was something completely different. So just make sure you observe very well during the first couple of days and then go from there.
Wow, yeah, thank you. That was fantastic. So I took down a couple of keywords that Dr. Howard and Dr. Brooks have shared. All right, probably one of the most important ones that I have is observing. Both of them use that, being adaptable, right? Figuring out ways to be helpful to the team, identifying that everywhere has a different approach, as well as being able to define what the roles are and the expectations for each place and each team you're on. And then preparation, which ties into practice, right? How much time are you spending practicing these things that you want someone to let you do? And then being proactive. So all those things are key, and I'll also share sort of my thoughts on the rotation. For most of these rotations, they're about 4 weeks long, and you want to get a full experience of what it's like to be in this residency program that you're spending your time in. So you have to do all these things that I just mentioned. And at the same time, you have to navigate multiple different personalities and try really not to offend anyone in the process. And really, the best way to do that is really taking that time to observe. So I break the 4 weeks down the way I tell students is this. So the first week, you should really be calm, quiet, more observing than talking. A lot of you have great personalities. People respond to different personalities in different ways, and you need to figure out who you're talking to. Are they a morning person? Do they want to really hear from you when they're in the morning when they're rounding, or do they want you to be quiet through rounds, and after rounds, maybe in between cases, then they pucker up and you could talk to them and ask them a lot of questions. If you meet someone, you start peppering them questions in the morning, like, hey, I have all this to do, and I don't really like that sub-I, So the first week really being quiet, I think, is important. Observe everything, see how the service is run, and make sure that anything that you can help with in that process, you identify that. And that anything that you're being told, you're only told one time and you're not told a second time. Then by the second week, usually that's when I say you start to open up a little more, ask the residents questions, about the program, about the area where they live, right? You spend that time getting to know them. And then the third week, you could show a little bit more of your personality, right? And see if it really is a good fit with them. And then the last week, you really want to be quiet again because you don't want to ruin 3 weeks of work and leave. And they say, hey, do you remember that med student? And so I think those are very key. And then I want to finish with something that Dr. Brooks said that was very, very important. He was on a rotation with another medical student, and together they made a dressing bag, right? And so the some people have it misconstrued that you are, in no way you are competing with other people, but you cannot look at it, if you're look at it that way, if you're rotating with someone on a team. And so whoever you are with on your rotation on a particular service, you have to make sure that you can work with them to make the service better, not doing things sort of on your own. But if you can bring them along or share ideas, that is really, I think, a great way to go about it, and it really makes a big difference if you can. Any thoughts, guys?
Dr. eBay, I just wanted to point out that we have another great resident on here, Virgil Owens, who might have been trying to hide in the background, but I know he always has a lot of great advice. And so if he was actually available to chat, just wanted to point out that he's on here too.
Hey,
Dr.
Dr. Brooks.
There he goes.
Yeah. So it's nice when you get a shout out from Dr. Brooks. So Dr. Owens, feel free to weigh in. I think, it really makes it an additional difference having a resident perspective as well. We were just sharing general advice for the students. If you have maybe some quick advice you'd like to share, and then we'll branch out into specific topics.
Yeah, thanks, y'all. I was just popping in because I like to listen in on these because I feel like it gives me kind of ideas and thoughts for when people ask me, like other med students and stuff. So, but for those who probably don't know me, I'm Verge. I'm one of the PGY2s at Carolinas Medical Center. I'm currently on night float, so I'm just kind of hanging out. It's pretty quiet, so we'll see if that changes. But a lot of what y'all have said is stuff that I definitely think is true, and definitely I would echo. You know, I was a part of the group who did multiple rotations up until now before COVID happened. So like, I did my home program and I did 3 OAs. And I think for me, one of the things that I definitely noticed was that the way to be helpful and the way to kind of show how I would be as a resident definitely changed depending on the program. There were definitely different needs that needed to be met based on where I was. Some places needed, me to be there early and actually like look up labs and look up things like this. And some places didn't need that at all. And really just needed a body for hands and splint materials and things like that. So it definitely really depended. I definitely believe that kind of paying attention to how a service is run and where you are is very important kind of for the first few days, and definitely picking up on stuff immediately and kind of picking up on that and then going from there as quick as possible, and being told once and not twice is critical. I think definitely some of the important things I would try to do, like pretty much my goal anywhere I rotated was, it sounds weird, but I wanted to make people like lose their job. Like my goal was to make like the nurse, like I wanted to have the nurse, make her job easier or his job easier. I wanted to make, if it was a cast tech, I wanted to make his job easier, her job easier. Like I wanted to be the one who's getting the splint materials. I'm the one who's like helping to get gloves and get gowns, and I'm helping to move patients. So like anywhere I went, I would try to find a need and fill it. I was always trying to do the job that nobody else wanted to do, whether that be, moving patients, getting stickers, getting consents, even cleaning up the room, or even if, there's like a cold brown in the OR, cleaning up, like just doing all of the dirty work, because I feel like that's what really shows the kind of person you are, is if you're willing to do the stuff that nobody else wants to do. And like if the resident is having 10 different things to do, putting in orders or talking to this consultant or talking to that consultant, like trying to be independent enough to where I could be the one who's like setting up a room to the point where once they're done with that, they can just walk in and say, oh, C-arms here, we got splint stuff, we got stuff to wash, we got all this stuff, to where they can just say hey to the patient and then, throw on the splint or reduce and then walk back out and do what they were doing. So I think that's definitely critical, is just trying to find ways to say, like, hey, I'm about to go do this for you or do that for you, without having to ask and basically trying to anticipate needs, I think is very critical. And like I said, I agree. It depends on where you are. So asking early, picking up on stuff early, and then making those adjustments as you go is really important.
Yeah, thank you for that, Dr. Owens. And yeah, absolutely. If you find out ways to be helpful like this, that is fantastic. You want to really, for you to help with splinting, you have to know where these things are. So you might not know that when you go to a new hospital, right? But the second someone takes you somewhere and shows you, you should write it down. What is the code to that room? You should write it down, right? So like your first week should be a lot of you taking notes, because the next time, if you want to help someone and go grab the splints and go grab something else, you're like, oh, what's the code to this? Oh, how do I get there? They're like, don't worry, I'll do it. So the second someone shows you something, that is so vital in orthopedics. Someone should not be telling you things one time, two times, three times. After one, that should be it. So and that's really how you make an impression. Like, wow, like I didn't have to repeat that. Wow, I didn't have to say that again. So thank you,
And
Dr.
Virginal said something very interesting, is that, don't be afraid of doing the dirty work, and don't underestimate who's important. Sorry, no, actually, the thing I liked about most that he said is that the sub-I brings out who you really are. And that is probably the hardest part about all this, is that if who you really are is a lazy ass, or someone who doesn't like working for very long, or someone who won't stoop low to do the dirty job, no matter what we tell you, that's going to come out in the 30 days. And so I think you have to dig deep inside and understand who you are to know what your faults are, and try to figure out how to mitigate that. I will tell you, my personal fault is that I don't get things as quickly the first time. And so I knew that I'm better usually at the end of whatever I do. And so I chose to put the rotations that I kind of cared about a little less first, so that I can get all my mistakes out. So when I hit the one that I really cared about, that I was like running on all cylinders. And so that's how I tried to mitigate my own weaknesses. So for others, like, if you know that you're a people person, like use that to your advantage. Like, make sure you're friends with the program coordinator. You have no idea how important those people are. If you're the person cleaning up, helping to turn over the room, like, trust me, like the ortho head circulator nurse, they're very powerful. They have the ear of all the surgeons. And if they go and they're singing your praises, that goes a long way, even more so than some attending singing your praises. And so don't underestimate who's really important, and don't underestimate the fact that you are going to be stressed and tired, and that's when your true personality is going to come out. And so if you have any personality deficits, be perceptive about that and figure out how to mitigate that.
Perfectly said. And with that, we'll segue into some specific topics that we could chat about briefly. The first one I have is study tips or read-in recommendations for students on rotations, as well as how to prepare for cases. Any thoughts, Dr. Howard?
Yeah, I think we probably all do some form of the same thing. I think Netter's Concise Orthopedics is a book that everyone should have. When you're the med student coming in, really the only thing that's truly expected of you generally from most people is to at least know the local anatomy for wherever it is that you'll be operating. So if you have a good grasp of that and just know, what you might be looking at in the OR, that goes a really long way. For me, I'm actually more about things generally being high yield. So I stray away from the books in terms of recommendations for people. I actually think OrthoBullets is a great source. So if you look up whatever the pathology is that you're treating, and what the surgical steps will be, even just on OrthoBullets, it's very concise and probably not enough to truly know everything about the case. But everything that is critical to know is highlighted. So I think if you're going to be at a place where they do tend to pimp a lot, the pimp-worthy questions are typically something that will be covered on OrthoBullets. Aside from that, the only other book that I would get is if you're doing a trauma rotation, then Handbook of Fractures is extremely useful as well. It just kind of gives a very brief and concise overview of all the different things you might see when you're on call. So it allows you to formulate a plan if you're, for some reason, whatever institution you're at, seeing patients initially by yourself and then running it by the person you're taking call with. Tells you like what kind of immobilization you might need and then what the eventual surgery might be. And then at our institution as well, once students start taking a call with their residents, they're allowed at bone board to then present those patients. So if you have that book too, then it really allows you to have all the pertinent details that the attendings will want to know and that you would need to know in order to effectively present that patient. So those would be the three sources that I would say. There's anatomy for the kind of general anatomy for the area, ortho bullets for the high yield key points. And if you're taking a trauma rotation or trauma call, then handbook of fractures is pretty useful.
Yes, and for a lot of the time on rotations, there's definitely a time crunch, and so these are things that you have to. Sometimes you feel like the high yield is necessary. It doesn't hurt to have a book with you at all times. Sometimes if you're reading up on your phone, people don't see it as you reading up on your phone. They think you might be texting on Twitter or on TikTok or Instagram, whatever people do these days, and so having a book at hand and the anatomy book, the Netters, is often a good one to have. And you open that and read through your anatomy. That's always good to have on you. The only other resource I will add to what you just said is the AO Foundation Surgery Reference. So the AO Surgery Reference has for each body part, each bone, they have the approaches, they have the things to worry about, they have reduction maneuvers if it's for trauma, and it's really easy to look that up before any case you're going into and say, hey, like, I need a crash course on this, and you just look it up and it'll tell you, okay, here's your approach that you're doing, here's what it is, and it'll help you with that. So combine ortho bullets with that, with the AO reference, I think is definitely a good way to do something quick. So if you find out what your case is that morning and you want to have some sort of idea what you're doing when you get there, that's something you have to do, because the only thing we care to ask you are the anatomy questions. We try not to ask you the more complex things. All right. The next question I have is about personal belief and politics. And is it something that you feel, and Dr. Owens, you could weigh in on this as well, that people should be bringing up during rotations, or if you do, how much should that weigh in the process?
Or John, if you're still there, you can take that though first if you want.
Sure, I can go. Yeah, so those situations are always pretty tough. I think that overall, politically, you're going to have a lot of varying opinions and beliefs on everything, and it's going to definitely be a spectrum. My personal stance on it and kind of how I approach that, because it's definitely going to happen. Like, you're going to be in awkward situations. Like, you're going to be in a 3-hour case with an attending who has political ideas and beliefs that are literally completely opposite of yours. Like, that's going to happen. My personal thoughts on it is that I'm not going to change anybody's mind in 4 weeks in a weight rotation as a med student, and that nobody knows. My thoughts is that I'm not going to change anybody's mind. They're going to think the way they're going to think. They thought this way before I left, and they're going to think that way when I leave. I think kind of where I drew the line is if there was any like blatant disrespect to me, or anything that was a personal attack on me, or on people who look like me. So that's kind of where I drew the line. But I think it's also, you have to be strategic about how you bring that stuff up, because at the end of the day, you're trying to get there and impress people who, maybe think differently than what you normally do. And unfortunately, it's kind of a gateway to kind of get to where you need to be. So those I always kind of tread lightly. If there is a big issue, I would bring it up to people that I knew, whether it be, other residents who were in the program or even attendings that I knew. Um, there was never, I don't think there was ever for me anything that was like so egregious that, it just kind of shell shocked me or anything. But there were definitely situations where where I had to kind of, play the field and kind of know who I'm talking to, and really kind of remember the end goal of like why I'm there. So I think you just have to be really smart about it, because it only takes one, you know, messed up situation to kind of hose you, and everybody, and then, that story can kind of propagate. So biggest thing is just use your common sense and navigate it correctly.
Yeah, I'd agree. I think it's tough to navigate because you obviously want to show your personality at some point during the rotation too. But in my opinion, I mean, I'm someone who's a little bit quieter by nature anyway, so it's easy for me. But I think you should never respond to any of those things. It's a trap and it's a setup. Like, you're dealing with a lot of smart people who are really like trying to see what you're about and want to see what your opinion is, and if you're willing to kind of step out and say something controversial. So you should never say anything. I think just like when a friend talks to you and says something you don't care about, and you're like, oh, word, that's crazy. Like, that's what you should just say the whole case. Like, oh yeah, that's crazy. But like, don't give any input. Because I think you're really just asking for trouble. Like here, I remember probably 2 or 3 years right before COVID started, we had a kid who was a stud, was crushing it on our spine rotation, one of our hardest rotations. And then we were reviewing applicants at the time of residency interviews. And somebody brought up that a circulating nurse didn't like the student because he said one thing. He told one joke that was perceived as being potentially sexist, and it was borderline, but you can't do that. And it literally, people say it all the time, it only takes you saying one thing over the course of an entire month to completely sink your application. So it's a hard line to walk because you want to show your personality, show that you're cool, show that you're funny, whatever. But I think it's dangerous, and you can definitely hurt yourself much more frequently than you'll help out by saying a bunch. So just be very careful.
Yeah, exactly. And so what it is, I think, is not being too comfortable. The second you become too comfortable and you think you're chit-chatting in your group chat with your friends, and you start sharing, all sorts of opinion, you never know who you will offend. And really just trying to stay away from any of those discussion, I would say. And you have to remember, you are still auditioning for a job, and everyone, no matter how cool they might seem to you, they're all watching you, and they're all waiting for that one moment that you might not do something properly. And so you have to, sub-buys are very stressful times. I mean, I was so exhausted after my sub-buys, because you feel like you're head on a swivel, like someone's watching me all the time. And really, that's what it is. Like, everyone from the nurses, the circulators, the scrub tags, right, they're all watching you, how you're behaving in the OR. Are you, do you seem bored during the operating room, like during the case? Like, are you engaged? Everyone is watching. So keep that in mind.
Yeah, and just to quickly echo, I agree. Like, when you get comfortable is a huge trap, and I think it's usually around the end of the third week going into the fourth week. Like,
Yup.
people, you're like, you're on a roll, you've been crushing it, and then all of a sudden you think folks, and that's the trap. So that end of the third week going into the fourth week, just be cognizant of it.
Yup.
If you know that you've got, like, if your humor is not, the most well received by your own friends, then you got to have the the wherewithal to realize that and just adjust.
Yeah. Yeah. And I mean, that sort of goes into what I said, that last week, just like, if you could just mellow out and not ruin 3 weeks of work, that's the way to go, because it will go just like that, and it'll be the only thing they remember, and not all the times you came in before everyone to round, and when you stayed late for call. They'll remember that one comment or joke. All right. Well, the next question I have is about letters of recommendation. When to broach this, how to broach it, what do you guys think about that?
So I asked at the end of my rotations. I did my home sub-I and asked at the end, and did the same thing for my first away. I think I've heard different things. You can let people know from the get-go, like, hey, I'm gonna be on your service for an entire month. I plan to ask you for a letter. I thought that it was a little risky because that means I'm definitely under someone's lens a little bit more. So my thought process was just to see like how I vibe with people over the course of a month. If I thought we got along, if I thought that I did well in their OR, then I would ask that person for a letter, and that's how I went about it. You really want to make sure you get letters from your home institution and your first away. So I would make sure you plan that first away smartly as well. I think the ordering of your rotations can be a tough situation to navigate for some people. Maybe your school has an off block schedule, so it's hard to get that first away when you want it, or whatever the case may be. Some people don't know when to put them. I think, like Dr. Brooks said earlier, putting the place you think you really want to end up last is probably what I would do, and what I did also. Just so that when you're at that location, you're not even focusing on trying to get a letter, you're just there to work, and then you already have your letters going in. So the first place, I would for sure try to pick somewhere where maybe you kind of know how things function through some means. Maybe you have a mentor there, or whatever, just so that you can kind of hit the ground running and get a good letter. But for me, I chose getting my letter at the end of the rotation.
How did you know who to ask?
So it's just going to be a matter of who you think who you mesh with when you're there. So obviously people who are more important with the program hold more weight, and who may have more of a name nationally hold more weight. So if you can get a letter from a program director, that's amazing. Same thing with people who are the chair of departments, that would be amazing. But I think an adage that I heard at the time that I was a med student is something I think still holds true. A letter from somebody who's not known well at all, who truly understands your character and knows how hard you work and can actually write something interesting about you, goes miles, probably more than a letter from someone who's very well known, who just said like, this Joe Schmo, whatever, it's on my rotation, did a good job, and that's it. So I think just making sure that you do well on a rotation, and then asking whoever is a physician at that hospital to write you a letter who you know can attest to how hard you're able to work and how good of a med student you are.
Yeah, and that's definitely a good way to do it. Another way is, when I break down the 4 weeks, usually at the end of that first week, you're going to start getting an idea of the residents that you can talk to and ask questions. I would ask them, hey, like, who would be a good person to ask for a letter, or write, or would write a good letter? And that was sort of my approach. And then the residents will guide you and say, hey, like, maybe you don't want to, like, that big name guy, like, you might not get that letter in time. It's like the applications will close and you won't have your letter. So maybe you should try this person, okay. And then we'll try to get you more OR time with them. We'll try to get you to spend a little more time with them so that you have that chance to impress them and get that letter. And so that would be the other approach. One is saying, okay, if you're stuck on one rotation for 4 weeks, but if you're going to be with different attendings back and forth, etc., you should find out, who's more likely to write me a letter, and then try to get and spend time with this person, go to their clinics, right? At least 1 or 2 of their clinics, and spend time with them outside of the OR when it's as hectic. And so these are things that you should keep in mind for sure. All right. So let's say now you've done your rotation, you've asked for a letter, which I think is very hard to do as a student, but you have to just bite the bullet and do it. Some people do it in person, some people do it via email. The second you do it, it's over. But before you do it, you get really anxious. But from an attending, we are human beings as well. You can come ask us questions. You can come ask me, well, definitely me, but you can come ask us if you want a letter and if you think you've done a good job. And it's not bad to ask if someone would write you a good letter, if it's really, important to you, and say, hey, like, and a lot of people will say, hey, like, I don't think I can write you a good letter. And that might hurt your feelings in some ways, but you don't want a bad letter at all. because that would do so much damage for you. But after all of this, how about staying connected afterwards, right? When you're on rotation, you get numbers from the residents. You guys can be texting back and forth, etc. What should the rotators be doing in terms of staying connected afterwards with residents?
I can start on this one. Yeah, I think it's definitely a balance. I think it's definitely a balance between contacting enough to where they still remember you, but not contacting so much that they remember you too much. I think it can definitely be tough because, there's definitely some people who don't reply at all or don't send out a message at all. And then you kind of get to interviews and then it's like, hey, remember me? And that's not what you want to do. But then there's also some people who will email every week, and that's also not what you want to do. So I think you got to kind of find yourself in the middle. My kind of how I went about doing it was, if there were people that I had a great connection with, that I definitely bonded with, whether it be residents or attendings, like at the end of the rotation, I would either talk to them in person if I could, or I would send them a message, via email or text if I felt comfortable with that. So I would try to do that with people that I knew at the end of a rotation and say, hey, I'll definitely reach out in the future. And then, kind of the next big time that I would reach out is, if I'm still trying to figure out any type of letter of rec or something like that, or when I'm about to apply, usually like kind of right before I submit, or if I'm just kind of like, hey, for this specific place, I might say something. I might ask somebody that I know, like, for this specific place, is there anything I should put in my application that's specific to this place or something like that? So those will kind of be my milestones. Another milestone, if I or another kind of point is if I got the interview, I would reach out and say, hey, I got the interview. I would love to chat. I got this date. Would love to chat before. Blah, blah, blah. That will kind of be another one. And then you could kind of talk to people right before the interview and figure out, how to do well. And then they could also remember you and get you plugged in. So I would do that a couple of times too. So that people knew I was coming and also I could kind of be ready for the interview. So I think you kind of want to kind of have planned, spaced out times where you want to reach out where it's not too much, but also you don't want to do the rotation and then show up on the interview and then like everybody's like, oh, hey, forgot about you. Like you want to have a couple points in time where you talk to them before then, because that I feel like that shows interest, and it shows that you're invested in the program, but I think it also shows that you're not being annoying.
Yeah, absolutely. And that conversation at the end could be something like, hey, had a great rotation. Is it all right if I, reach out down the road if I had more questions about the program? I think that's a good way to broach it. And if sometimes you end up having like a really great connection, with the residents. Sometimes like on one of my rotations, if I can remember as far back, I think the resident was having a baby, and I remember it was a very stressful time for him. So we exchanged emails afterwards about his baby, etc. And so if you have something that you I don't have a baby, but that you connect with them on, trying to reach out to them about that, I think, and follow up, is definitely a good way of showing interest. And no matter how you look at it, orthopedics is very competitive. I think the match this past year was like around 50% or something, right? So, um, like you have to do, everything you can, especially if you performed well in the rotation, to make sure that they know that you're interested. Dr. Howard?
Yeah, I mean, I would agree. I would offer a slightly different perspective. And I think for me, just it goes back to being adaptable. So just know your audience. Some people are cool with that. And they have no problem if you hit them up once a month, just be like, hey, like, still had a great time there, rotated somewhere else. For sure, you guys are like the place I'm hoping to end up or whatever. Like, that's cool. For me, I don't ever really want to hear from people like I have stuff going on. You know what I mean? Like, I think most students feel like they need to make this contact all the time. And the truth of the matter is, if you do a good enough job on your rotation, nobody's going to forget you. We're going to go through, like, your name is already highlighted so that we make sure that we're interviewing you because this kid was a boss. This guy or girl, like, was amazing when they were here. So if you did your job when you're on a rotation, in reality, like, you don't have to do anything after that until you get to your interview. I would advise when your interview comes up, especially if you're interested, hit up whoever you're on your rotation with and be like, hey, coming out to interview, anything I need to know about the interview coming up, just so I can make sure I do well. Like, is there a room that, you know, tends to be tough for people, whatever? Because if people like you, for sure, they're going to let you know things to be aware of going into the interview day. But otherwise, I do think it's okay if you message someone, but for a lot of people, it comes off as being a little bit more needy and insecure about your position as a student, more than just being genuine, like hitting me up. Like, you're not going to become best boys or girls with somebody over the course of 30 days while they're grounding out. For most people, or maybe I just don't have a lot of friends, I don't know. But I don't know, just take it, again, for me, everything is all about being adaptable. So if you feel like you have someone who's amenable to that, feel free to hit them up. If that person's not super talkative, don't text them. They might be annoyed.
Exactly. I love the varying perspectives. So we're going to finish probably with a couple, maybe short horror stories before we get into questions. I can go first. I remember, and these stories, they might seem so, you might hear it and say, like, wow, like, why would this person do that? But long story short, I mean, we had this rotator, and they were very confident in their knowledge, to the point that they started pimping the intern, and so, as much as you think you might know, um, probably not a good idea to start pimping any residents whatsoever, right? Because they already have that position, right? And so that doesn't come across as a good team player. And so that's something that I when we heard that, and when people saw it, automatically this person was crossed off the list and would never be ranked and wouldn't get an interview, right? And so these are things that you should never do, right? Don't start pimping other rotators. Don't do it. No need, right? Like, you could teach them something if you want to in your own spare time with them when no one else is listening. But don't start pimping them, asking them questions in front of people, and definitely do not do it to residents. Any stories you guys have heard of that have happened on your rotations?
Can't think of anything off the top. I remember when I was rotating at my home institution, there was a dude rotating also, and a resident told him that we were going to meet early to discuss a topic and to let me know. I don't know why he just texted me himself, but told the med student to let me know. He never let me know, so I ended up showing up around at the normal time we do, which the resident told me, he was like, don't worry about it, it's not your fault, but ended up getting that kid like blacklisted because he was like, that's not somebody being a team player. So
Right.
I think somebody alluded to this earlier, but there's no need to feel like you're in competition with other people on your team. Just do you, be the best person you can be, and try to work in tandem so that everybody kind of shines. And I think that goes a long way. I would say a big no-no, since we're talking about like things you shouldn't do, that always gets people blacklisted. You should never, ever, ever complain about anything. It doesn't matter if the rotation sucks and you think that you don't want to be there. People talk. So not only will you hurt yourself at that institution, but potentially other places. And there's no quicker way to get the disapproval of a resident or an attending if you're already complaining on your sub-I. So some of them are tough. It's honestly, sub-I season can be more rough than residency at times because you have to impress all these people that you're just getting to meet. There's typically at most places no post-call days, so your hours stink and you don't really know how to fit in and how you can help, but you just always have to have a positive attitude, and make sure you come to work every day like that. So.
Yeah, and again, I'll harp on that. If you function as a good team with other medical students, it automatically puts up a green flag that you can work together as a group. You're going to be on rotations with people for the rest of your residency, right? All 5 years. And you guys need to be able to make it work. You need to let the other person know when we're around it. You need to be feel like you're responsible to some degree for the other person's well-being. And the better people do on a rotation, and you leave the rotation like, wow, that rotation was very important, the better it looks for you two who rotated, or three. And then the last thing I'll add to that is you make sure that you pass that information along to the next group of rotators. That is sort of the next level, I think, because if a rotator comes and does really well in the rotation, and then the next group comes and there's a big fall off, right? Sometimes that looks bad on the first rotator because they did not pass along the key information that made them successful. All right. So you have to make sure that you are really all in all a team player and sit down and say, hey, this is the sign out for the rotation. This is how the rotation runs. Here's where you get this. Here's where you need to get this. And if they do well after you, they're like, wow, the service has been running smooth now for 2-3 rotations. We really like what this person did. All right. So with that, we'll open it up for questions. If anyone has any questions, you can put it in the chat and we will address those for you. Or I think you can raise your hand and speak.
Until one comes in, I'd also emphasize getting a mentor early on, like a resident mentor is cool. Normally on your rotations, you'll have to do like a 10-minute presentation, sometimes longer. And getting somebody not only for like general stuff in terms of how to be prepared on your ways, but somebody who can look over any presentation you put together, just to make sure you're hitting the right topics when you present, goes a long way. So just getting someone who can kind of show you the ropes that you're tight with, who doesn't really have any vested interest in where you end up and just wants you to succeed.
All right. We have a first question here. It says, can you tell us about a memorable student that you've had? All right. Oh, okay. We just got a bunch. All right. So maybe we'll take one at a time. I'll do the first one. So memorable students. I mean, there are, it's, I think in orthopedics, we're very fortunate. There are a lot of excellent people, excellent candidates. And a lot of the people who were my sub-Is, like who have been my great sub-Is, I stay in touch with them. Like, and they all have similar traits, right? They care for the patients, they care, even though it's not their program or might not be their home program, they care about the program. Like they care, very much. And I think that sends a good message. Like if you're someone that really is thoughtful, cares for the patients, like that's what people want. Like being a good team player, that's what people want. Speaking, figuring out when is the right time to speak, that is probably one of the hardest things. But as long as you don't get too comfortable, you'll be able to tell this is the time to ask my questions. This is the time to have a conversation about weekend plans or whatever else is going on. And I think those are probably the things that make the students stand out. And I've been fortunate to work with a lot of excellent sub-Is, and I'm sure you have as well. Yeah, you want to do?
I'm happy to take this application one if you want.
Yes, please.
The only reason is because this year I was actually a part of the sub-I kind of application committee here. So I helped kind of sift through and pick out people who would rotate. I would say overall the apps are pretty competitive. People have really good scores, and a lot of people, like minus curing cancer, have done a lot of really amazing stuff. So I think the pool of applicants for ortho is just amazing. It's like just outstanding. So yeah, I mean I think it the stuff that you do versus somebody else, I think it is also subjective, right? So um I think one of the things, you want to have a really good CV that's well-rounded, um and you want to have competitive scores for ortho for sure, just because I think the more, as time goes on, it's just getting more competitive. But I also think that you have to put yourself in the best light, and you have to be your best advocate. um I'll tell y'all that, I'm at CMC, and I actually didn't even get the away initially. um so I ended up kind of reaching out to people, and the program director here, he believed in me and said he wanted to give me a shot, and it worked out. So I think, even if you feel like there are some deficits, or if you feel like you're not as competitive as other people, you still have to put your best foot forward, and you gotta be your best advocate, because nobody else is going to do it for you.
Mm, all
Agreed
right.
with all that stuff. I would only just, for the logistical aspect of things, having also done what Virg just said, make sure that you're all looking at the deadlines and the opening date for applications on the AMC website. There's a ton of students who will end up wanting to apply, and they apply late, and that's the biggest thing that can hurt you. For, I would say, a vast majority of institutions, as long as your stuff is all ready to go from the beginning, you'll probably end up getting a spot. It might not be your preferred subspecialty, but normally they can accommodate you in some way. So just make sure you have everything ready to go before the applications are ready to be sent out.
All right. Do you want to take the next question on there? It says, what are the tools we need before we start our sub-I?
I was no great answer. I think, like, again, it goes back to being adaptable. Every place will be different. The biggest thing, really nothing. I think if you're in the OR, one way that med students do get to shine is at the end of the case, normally it's just you and a resident. So if you come in, at least having a basic understanding of how to tie or how to suture, I think people appreciate that. And it shows that you have practice outside of the OR, at least you've had some semblance of experience. But um, I don't know if you guys have more input for this one, but I think it's really hard to predict what's going to allow you to be useful, because it can be markedly different at different locations, depending on what subspecialty you're on. Really just being available and an active learner is all you need to come. So positive attitude, you'll be straight.
Yeah, and then I'll add, just have a good notepad, an anatomy reference that you keep with you all the time. And the notepad, so you're taking notes about everything that's happening. They're going to be codes to the resident room, codes to the storage rooms. You need to have all those things written down so you don't forget. You can put them in your phone. Just be careful when you use your phone, because people can interpret that as you not paying attention. So you have to be very careful when you're doing that. All right. The next question is about study resources for oncology rotations. Okay, I'll take this one. AO surgery reference seem more trauma focused, and that is true. And I think that's a big thing with oncology. We don't have a lot of general references. Now, I will make a shameless plug. I have a podcast on sarcomas, and it's a good place to start for general information regarding various sarcomas. I think the next area is orthobullets. It's very useful. And then probably the last thing I would say is trying to go on PubMed and search specific tumors individually. They're usually very good review articles. That'll be the other thing I would add. When I was on certain rotations, especially things that I wasn't very familiar about, at the end of the week, if I knew what cases would be the next week, I would go and look up a bunch of review articles about the topics. And sometimes, but it helps you start to build your knowledge base for orthopedics. So that's what I would say. My podcast is Sarcoma Insights. If you want to listen, um, and I would recommend Orthobullets for sure. It's very useful in terms of summarizing what you need to know for tumors. All right. Next question.
I mean, I could take, it looks like Rodney's. I didn't see that question on mine, so it might have been directed to just you. The next one I saw was Rodney's. Different programs, seeing different cultures, and how do you toe the line between being over eager and being too laid back when you're not sure of a program's culture. I think just going back to echo what everyone said. I think that first week you're in the rotation, you can definitely just chill back. That doesn't mean you're acting uninterested or you're uninvolved. That just means if you know you're someone who has a pretty strong personality, or if you're a super talkative person, like that's cool, but maybe hold that back from the beginning. Make sure you're always active and available to do whatever is needed to help out the team. You can kind of act when you're told to act. And I think after that first week is over and you kind of see how you're best able to fit in, and you see like what the vibe of your team is. Like sometimes people are super chill, they like joking around a lot, whatever. Then you can kind of adapt and try to fit your role in. And no one's ever going to fault you for being quiet during your first week. I think we all understand that you're trying to impress people, and you want to come off as being intelligent and a cool person, but we don't expect you to come in like guns blazing. I think the people who do that are actually the ones who we end up not liking as much at times. So just to reiterate what's been said before, during that first week, just make sure you're really paying attention to how the team is functioning. And then from there, not only, with respect to patient care, but how lax you can be with just speaking to the residents. I think you can gauge, how you can act appropriately.
Yeah, and I definitely echo that. I think you definitely got to understand who you are. I think people have different challenges with that at different stages of the rotation. So, for example, I'm at baseline kind of laid back. So for most of my rotations, that works well starting off, but it's a challenge later, right? Because later you want to kind of open up and actually show who you are and more of your personality. So for me, I had to make a concerted effort to try to, be more open and, more outgoing as the rotation went on. And it's the opposite for people who are kind of more extroverted, people who come in guns blazing, and kind of like showing just talking off immediately. They have a lot of trouble, but they may have an easier time kind of later as they get to know people and they can show their personality more easily. So I think you just got to understand who you are. I think generally introverts and stuff have a little bit more trouble on rotations and even interviews. So if you are more introverted, because I'm a little more introverted, I think you just have to recognize that. I think it's perfectly fine to be introverted, but you also have to find the balance of like, all right, there needs to be a time where I kind of speak up and kind of actually get to know people. Um, so just be wary of that too.
Yes, I feel like that was definitely one of the hardest things about sub-Is is you really have to start knowing yourself, right? How you learn when you're stressed out, um, how you behave when you're stressed out. Like I realize like I have a resting face that is not very pleasant. Uh, like I look confused. And so like I had to start, working on my, you know, my head nods, oh yeah, like little facial expressions, so that people then felt that I was actively listening to them, right? So just these little things about yourself, because you are being scrutinized constantly, and you have to keep that in mind. um with that said, any other questions? All right, if there are no other questions, we will wrap up this episode. That brings us to a close. We did not have a couple people with us today. Dr. Lipa, who is on call and was stuck doing the spine case, and then Dr. Purcell was supposed to be on moderator. If you don't know Kevin Purcell, you should. Everyone knows him. I went to academy with him, and um, he knew literally everyone. But he's preparing for his board examinations and was unable to be with us today as well. Uh, Either way, thank you all for listening. Really appreciate you guys, especially Dr. Owens and Dr. Howard, as well as Dr. Brooks. Thank you all.
Thanks for letting me chime in, y'all. See ya.